Thank you. Just to know, I've been listening to the hearing from the comfort of my office. Thank you. Again, a couple questions. First, I'd like to ask you about biologics. And I know we talk a lot about reducing the cost of healthcare by getting the cost of prescription drugs down and so forth. I just read an article that said that what we should be looking at, or what might change that dynamic, is the use of the specialized drugs aimed at particular person's genetics and so forth. Can you comment on that? Or someone comment on that?
Maybe I'll start, but maybe Dr. Lowy would like to comment because a lot of the biologics are relevant to cancer. Biologic is basically a therapeutic which is a complicated molecule, generally a protein, to be distinguished from typical drugs, which we call small molecules, which are basically organic compounds. Biologics are more complicated to make, so there's always an issue there in terms of the production, but they can be very targeted, particularly, say, for instance, if it's a monoclonal antibody. And there is certainly this effort, and you can call it precision medicine, and you'd be right, to try to identify therapeutics that are right for that individual as opposed to a more one-size-fits-all approach. And cancer is right in the very leading edge of that kind of transition. I don't know, Dr. Loy, what you would want to say about this issue.
Biologics really are one half of our armamentarium when it comes to cancer treatment. The other half really being a combination of standard chemotherapy and precision medicine, which are small molecule inhibitors and are easier to manufacture. As Dr. Collins says, the manufacturing of the antibodies and verifying that they work, et cetera, is an extensive process. And I think that in terms of, we were talking earlier about pediatric cancer, for example, there was an indication that a monoclonal antibody might be useful for certain children with neuroblastoma. And because of the lack of the economic incentive for doing this in the private sector, the NCI actually manufactured and had this monoclonal antibody tested. It turned out that it did improve the outcome for children with high-risk neuroblastoma, and then ultimately we transferred the manufacturing to a production company. If there are other questions, I would be happy to answer them either
Thank you.
offline.
And I guess I'll just end with a question that you probably won't be able to answer because I'm running out of time, but I was curious whether you have heard of, and are you doing any research on what's called gender bias in the medical profession?
Yes, we are very aware of that concern. Be glad to talk with you about that.